At this point, if you have not heard about the coronavirus, you've either not had any form of access to the internet for a really long time or haven't left your home at all in the last 3 months. And if you haven't left your home, you've probably been safer than most of us out there for a long while. But just a quick recap. The coronavirus, also known as COVID-19, is basically a respiratory disease that's been traveling all over the globe, and it's obviously a big problem. A really big problem. But another heavily related note, I think it's important that we talk about social distancing in a bit of a different way. What you may not know and why social distancing is one of our best options at this point. Let's talk. Now, the entire coronavirus situation is a mixed bag at this point, mainly because the situation at the point of origin, China, has been heavily dealt with currently. But the bigger issue is the fact that the situation is getting worse and worse all over the world, with the case count increasing more and more every single day, and current numbers are going up exponentially, and that in itself is a very scary situation. Looking at the statistics, everyone else in the world right now is going through what China went through previously. We're catching on at a scary rate, and one of the biggest reasons for that is the fact that the disease wasn't taken as seriously until it got to closer shores to everyone else. I mean, just in the US, according to current transmission trends, if the number of cases were to continue to double or triple every 3 days as they currently do, there would be about 100 million cases in the United States by just May. That is, of course, if this isn't properly dealt with. While China is now at some level of ease, having only 0.01% of the population being infected by the virus and currently not seeing any new cases of the virus in the country, the rest of the world is increasingly seeing newer cases in the virus daily. China has hit a plateau, and we're currently behind them by a few million steps to see a similar outcome in the rest of the world. One of the biggest things being spoken of right now is the fact that everyone should stay at home and practice social distancing. But the question is, why? Why do international governments want everyone to stay away from their jobs, most likely their sole sources of income? Why does everyone need to stay at home? And why does everyone need to minimize all contact with the outside world? Well, here's why. It's quite logical actually, and no, we're not going to be talking about whether or not international governments want control over the world or anything like that. I did not make this video to discuss that, but the logical reasons for the distancing based on one very important predictive model which has been presented by the Washington Post. These two diagrams on screen basically are meant to simulate the spread of a fake disease throughout a population. One with the populace moving around as normal, and one with a limited amount of movement among the populace. In the first graph, it's important to notice how the slope of the red curve, which represents the number of sick people, rises rapidly as the disease spreads and then tapers off as people recover. In the second, a quarter of the population continues to move around while the other 3/4 adopt a social distancing strategy. The spread is greatly diminished. Now, clearly, the second diagram is more of a perfect scenario. Currently, we still have large percentages of the population worldwide moving around, especially younger people, and this is where the problem arises. Now, statistically, people under the age of 30 have the lowest chance of contracting the virus and dying from it, unless other medical circumstances are mixed in, such as having a chronic disease. That much is all well and good, but the issue isn't the fact that younger people cannot suffer immense damage from the virus. The standing problem is the fact that they can still travel with particles on their body and transmit it to older people who are more fragile and are at a greater risk. This is one of the biggest problems: unintentional transmission. Young or old, while a younger person may simply think that they have the flu, it might be that they have the disease at a weaker strength and unintentionally transmit it to a family member. That much is clear, but age is not exactly what I wanted to speak about. It's more around the issue of listening to your government. Listen to the officials in charge, and honestly, I don't care if you love or hate them, they are right when they say to stay at home and minimize the amount of movement which you do outside your home. That's your best bet. Minimize the risk of spreading the disease or contracting it. Don't be an idiot. Don't go outside unless it's extremely necessary or unless your job is necessary during these times. And as you've heard like a million times already, wash your hands, use soap, and seriously just stay inside. Thanks.